going back to COVID and how to improve your immune system, I think it's one thing that's not talked about as much is the effect that stress can have on your immune system. So we talk often about, eating healthy and doing exercise, all of which is very, very important. But one of the things that we don't talk about as much is your mental health. And it's actually been proven in research studies that stress, chronic stress, acute stress can have serious negative impact on your immune system. And everyone has stress, that's okay, but having ways to deal with it is really important. And especially during a pandemic, being at home all the time or having family members who are sick or being stressed about your job, or your school can cause a lot of mental anxiety. And so my biggest suggestion for improving your immune system is to find ways to relieve this stress and really focus on taking care of yourself, because that'll make a huge difference for your immune system as well. On that note, how do I balance my personal and professional life? I actually really don't like the word balance. I think in our career-oriented world today, it's really, really hard to separate professional and personal lives completely. And I don't think you should. Even when I'm outside of the hospital, first of all, I work 80 hours a week in the hospital. And even when I'm outside of the hospital, I'm doing research, I'm reading up on my patients, I'm studying for exams. It never really ends, but I love what I do. I love, love, love what I do. So it doesn't feel like work. And I think that's honestly the most important thing. That being said, you do have to take time for yourself. If you only keep doing one thing, you will get burnt out. So you have to find the things that you enjoy. So for me, that's watching TV, movies, or reading a book. I love reading. Just getting my mind off of things is really helpful, and maintaining your hobbies outside of work and maintaining personal connections is really important with your family and friends. Do I think that people with medical problems like diabetes and blood pressure need to take special precautions during COVID-19? Absolutely, 100%. So even if your diabetes and your blood pressure are extremely well controlled, even if your blood pressure is 120/80, you are still, just by virtue of having that problem, are at increased risk of having serious complications from getting the COVID-19 infection. We've seen that patients who have heart disease, diabetes, these patients tend to have poor outcomes when they get infected by the COVID virus. So the best thing you can do is, if you have any of these medical conditions, is to take extra precautions to avoid getting COVID-19 in the first place. So that's wearing a mask, staying at home as much as possible, washing your hands, staying away from large groups of people. So doing things like that, and of course making sure that your diabetes, and your blood pressure, your heart disease, whatever, is all well controlled, is really important during this pandemic. What is my stress buster? I kind of addressed this already, but like I said, I love reading, and when I need to just get away from everything and just not think about anything that's going on, I like to read or go for a walk, just get some fresh air. But if something is really on my mind about a patient or something that happened at work, and I just need to talk to someone about it, I think it's also really helpful for me to speak with my family or my friends who can help me think of what happened from a different perspective. And just help me vent, even if nothing else, just help me vent. And I think having those personal connections is so important for your stress, and just helping to ground you when feels like everything is going wrong. And lastly, what message would I like to share with you guys as a doctor? I don't know if any of you or many of you want to go on to do medicine in life or be a doctor, but if there's one thing I learned, it's during all of this, and I know that I've only just started my career as a doctor, but the one thing that I've learned is that it's an incredible honor and an incredible privilege to be a physician, to have patients be so vulnerable with you and share their lives and their stories with you that they might not share with anyone else. And that's incredible. And with that also comes an incredible responsibility to care. And with that also comes an incredible responsibility to not only care for your patients in the clinic and in the hospital, but also to speak up for those who don't have a voice. I think the most powerful story I remember of this is actually from when I was in medical school, and I saw a patient with my supervising doctor who suffered from diabetes, and her sugars were very, very high that day when she came into the clinic. And I think any doctor would have been right in saying, listen, you need to take your diabetes medications. You know, if you don't, these are the things that could happen, and you could die from this if you don't take care of yourself. But that day, the doctor that I was working with really went above and beyond. She sat down with the patient. She asked her, you know, why is it that you're not able to take your diabetes medications? What's going on? And the patient told us that, you know, she had recently moved to a new house, and in that apartment there, for some reason, the refrigerator wasn't working, the fridge wasn't working, and the owner, no matter how much she called them and tried to get them to fix it, was just not fixing it. And so the diabetes medications that she's on, the insulin, needs to be stored in the fridge and needs to be cool. And because her fridge wasn't working, she wasn't able to store the medications, and so she wasn't able to take them correctly. And so the doctor, rather than telling her, you know, oh, that really sucks, you should go figure out how to do that, she actually called right there with the patient in the room, in the clinic room. She called the apartment owner and told him, listen, I'm a doctor. My patient is going to die if you don't get this refrigerator fixed right away. It is not okay for this woman to live in an apartment where the fridge doesn't work. And before she got off the phone that day, she made the owner promise that he would go and get it fixed. And so that really stuck out to me, because it made me realize that medicine is about so much more than just prescriptions and telling patients to take care of themselves. It's about really going above and beyond and thinking outside the box about how to advocate for patients, both in the clinic and outside the clinic, even if it doesn't fit tightly into what you learned in the medical textbooks. And so I hope that even if you don't go into medicine, even if you decide that being a doctor isn't right for you, that you'll remember in whatever field you go into that you should give a voice to those who don't have one. If you have the power and the extra authority in whatever field you go into, just use your passion, use your compassion, your empathy, and your desire to help people to really to go beyond what your job entails and speak up for those who can't, because that's the way you're going to change the world.